Good morning, Kunal sir. Am I audible?
Yes, ma'am, you are audible.
Okay.
Ma'am, we are waiting for the 2 or 5 minutes for the maximum number of participants as well as the speaker to be joined.
Yeah, yeah,
Then
of
we will
course.
start.
Yeah, yeah.
Hello. Hello.
Yes, Kunal sir.
Madam, there is a number of participants around 180 is already joined and some of
Okay.
ours are going to be joined and speaker are already there. So we can proceed for the session. So
Okay.
1 minute. I, Kruna Solanki, welcomes you for the second plenary sessions of the 2 day online refresher course for registered pharmacists. For the second plenary sessions, I would like to invite the Mrs. Heta Kacha Madam, Assistant Professor, Department of Pharmaceutical Chemistry and Pharmaceutical Analysis in Indukaya Impala College of Pharmacy, would introduce the next speaker or the next resource person, Miss Swati Kurskoti Madam. Over to you, Madam.
Thank you, Kunal sir. It's my privilege today to introduce Ms. Swati Koti ma'am. She is currently working as Assistant Professor, Department of Pharmaceutics and Pharmaceutical Technology in the Ipkola College of Pharmacy, CVM University. She has completed her B.Pharm from AR College of Pharmacy and G.H. Patel Institute of Pharmacy and her M.Pharm in Pharmaceutics from PG Department of Pharmaceutical Sciences, Sardar Patel University with gold medal. She has completed her PG Diploma in Intellectual Property Right Law from National Law School of India, Bangalore. She has 4 years of experience and 4 years of research experience and 8 years of academic experience in the field of pharmacy. She has number of research publications in her name in a journal of repute and guided 5 MPharm, 12 BPharm students. Her research interests includes targeted drug delivery system and novel drug delivery system. With this brief introduction, I would like to welcome you, ma'am, on behalf of ISCP.
Thank you, Heta ma'am. I hope I'm audible to all.
Yes, ma'am, you are audible.
Thank you. Once again, thank you, Heta ma'am, and thank you, Kronal sir, for providing me with this opportunity. I'm privileged that I would be sharing with you certain knowledge regarding emergency management of poisoning in front of you all, though it might not be an area of expertise of mine, but I would like to share my view for the fellow pharmacists to refresh their knowledge regarding this topic. I'll be sharing my presentation with you all. Let me know if it is visible or not.
Yes, ma'am,
Is it
your
visible?
presentation is visible.
Okay. So as we know that my topic would be emergency management of poisoning. We'll be beginning our presentation with a small quote that I have it with me. That is, poisons and medicines are often the same substances, but they are given with different intentions. So, all substances can be considered as poisons. There's none that is not a poison, and the right dose differentiates poison from a remedy. Now, it is very clear why we are over here to understand about this topic because there's no difference whether you call it a chemical or you call it a poison. The only thing is how you take it, with what intention you take it, with what severity you take it. It can be converted from being a simple remedy, being a simple chemical, to becoming very poisonous substances. So, if we try to formally define what is poison, so poison is any substance that is harmful to the body. A more complicated way of defining it would be it is any substance, whether it is in the form of a solid, a liquid, or a gas, which when administered in living body through any of the routes, maybe it is inhalation route, you inhale it, you ingest it, you take it through your mouth, or you come in contact with it will produce some ill effect or death by its actions. Now, these actions may be in the form of physical action, chemical action, or the physiological properties. So, because of this, any substance would can be categorized as a poison. And when we are talking about poisoning, poisoning is the harmful effect which is caused by exposure of these substances, which we call it as toxins or the poisons. This may occur through the ingestion, inhalation, injection, or the skin absorption route. That is what we said. So, routes of poisoning, if you're talking about, it can be any form, but it should be entering into our body, into our system. You can breathe it, you can have it because of the contact with the particular material. It might be because unintentionally or intentionally somebody has swallowed the substance, or it may be injected. And what is more of importance to us right now is poisoning is a common medical emergency in any of the country. It is not like restricted to a developed country or a developing country or an underdeveloped country, but to any country. This poisoning is an entirely emergency situation, and entire department is available for it, which is generally working under the emergency sections. So why do we need to be understanding the importance of emergency management, or why poisoning is becoming such an emergency or a threat? To understand this, we have some statistics available with us. Poison statistics, if we see, there are about 31 children under the age who die every year. That is an average number. Though this number may seem very small, this is an average period of calculation between 2018 to 2020 when the calculation was done. Every 31 children who are under the age of 5, so if we are saying they're under the age of 5, most of the cases would be unintentional consumption of poisoning. They die due to the poison, effect of poison. The number has reduced from 216 patients that was seen in 1972 when the awareness was not there at all to 31, which is considered a very significant reduction in the number. But if we see that the overall in the world, Black African Americans as well as the Hispanic population is more prone to this kind of poisoning. 31 might not seem a very big number to all of us, but if we see the children, 61,500 children were admitted in emergency room because of unintended poisoning. This was the case scenario in 2020. And out of this, 18,000, somewhere odd 18,000 children of the age below 5 had injected medicines, and which turned out to be poison for them. These medicines were general medicines which are available in almost all the households, like the BP medications are there, paracetamol is there, antidepressants, some dietary supplements, even bleaching agents, etc. So the number is turning out to be very vast if we see in case of the worldwide. If we see in case of our Indian statistics, NPCI, that is the National Poison Information Center, they received somewhere around 16,420 calls in 2016 to 2006 to 2016, and all these calls were related to poisoning. Now, this number is the number that has been recorded because of the phone calls that were received. This is not the exhaustive number. There were more number than this who might be have suffering from poison, but approximately the registered numbers were somewhere around 16,420, out of which 7,104 were because of household products. And in this also, we see that this in the numbers that we have, 38% were adults who were poisoned, whereas 61% were children who have suffered this poisoning. Because the number is larger towards the children's side, we can also explain that 66% were unintentional, but 33.2% cases that were registered were because of some intention or some motive. Now, this statistics makes us believe that there is a need to monitor poison. There is a need if we find out that somebody surrounding us is suffering because of poisoning, that we need to be able to do certain type of help to them. And there comes the picture of emergency management of poisoning. If we see the common causes of poisoning that we are having, the first and the foremost cause is household chemicals. Now, this household chemicals would be including your cleaning products, which you might feel that they are harmless. Certain phenyl or certain glass cleaners that are available, the nail polish removers, to some extent even nail polish, the smell of the nail polish remover, which many a times children, even adults are addicted to taking it, inhaling it. Now this can be harmful and may lead to some poisoning. There are other personal care products also, which fall under the category of household chemicals, which are responsible for poisoning. Then we might be having over-the-counter drugs or prescription medicines, this which may be taken intentionally or unintentionally, or they may be combined with other medications, or they may be taken in a wrong way because the patient is not aware how to take it or with what it is to be taken. In later of the lectures, you might be studying about drug interactions, drug food interactions, herbal drug interactions, etc., where you would be understanding more that how the simple over-the-counter pills that we are popping randomly can lead to certain cases of poisoning. Drugs of abuse, now this is more of prominent in case of adults and youth, the generation where they are under peer pressure, or they were some adrenaline junkies who are like want to try it once, they become addicted to it, overdosing, overconsumption, again leading to poisoning. Environmental toxins may be there, like inhalation of gases, particularly when you're moving through certain areas or the certain industrial areas where waste management is not properly done, where the waste is removed into the atmosphere. The atmospheric air is polluted with harmful gases, which you may not be knowing, and you are unintentionally inhaling it. There may be pesticides. Now, this pesticides is particularly of more harm to the farmers, and when they are spraying the pesticides, when they are in contact with the pesticides can be causing poisoning in both the manner, in inhalation, sometimes in ingestion, as well. Contact dermatitis or contact kind of poisoning may also be seen with the pesticides. We have plants like poison ivy is there, poison oak, mushroom, which taken unintentionally or rubbed through the skin when you are walking around. That may also be a cause of poisoning. Metals such as lead, mercury, which can be found in old thermometers, batteries. We have arsenic poisoning, which is generally a slow poison seen in case of deliberate poisoning. Mercury, because of the lying thermometers, the shiny liquid that is present over there, which might be more tempting for the children to consume it. We have lead, which content is more in case of paint. Small children are of the habit of licking the walls because of many a times because of calcium deficiency. Also, they simply stick out the tongue, lick the walls, and if at that time we are not taking care of it, whether the paint that is being used on the walls is having lower limits of lead or the lead content is very high, that may serve as an indirect way of consuming the poison. Contaminated food. Most of the poisoning cases are food poisoning only, which is due to the contaminated food, mixing of food with adulterants. And finally, the venom, which is from the certain snakes, that is snake bites. Not just the snake bite, but there are other insects like scorpion is there, other insect bites are there. But these are maybe falling under the category of absorption type of poisons, or these may be some injected type of poisons. And the treatment strategy that is being used for snake bites is completely different from the emergency management of poisoning, which is occurring because of any other substances that have been listed over here. If we see the further statistics, alcohol intoxication is the major cause of poisoning. That is 29% of the cases is because of alcohol intoxication. It's not simply just alcohol consumption or overconsumption of alcohol which may lead to poisoning, but alcohol consumption when a patient is on medication, or alcohol consumption along with ingestion of certain other medications or drugs of abuse are more prominent to poisoning. Then we are having 29% cases which are also of OPC poisoning, that is organophosphorus compound poisoning. Somewhere around 9% is because of drug overdose, where here the drug overdoses would be of the OTC medications that are available. Rest of all would be included into smaller sections or smaller categories. But falling after this drug overdose is snake bite, which is again 8% of the cases where snake bites, particularly in India, we have seen that snake bites are more prominent to poisoning. I was not able to obtain the pesticide poisoning statistics for the state of Gujarat, but I got it for the state of Maharashtra. They have done a study on between 2014 to 2017, sorry, 2018, where they have found that pesticide poisoning is the major cause of death in the farmers. Now, this is because of unintentional as well as intentional poisoning. Somewhere around 272 people have died, 272 farmers have died due to pesticide poisoning. And this death is majorly because the timely treatment was not available to them. If we further see the types of poisoning, 43.7% poisoning is only and only because of household pesticides that are available at our home. 21.8% cases are because of the household cleaners that we are using. Mercury falls behind for 5.2% cases. The small naphthalene balls, the antiseptics that we are using, even kerosene that is being used, they cause 10% of the cases of poisoning. We might be finding these as products which are not of much importance. They may be lying around at our home. They are for the purpose of cleaning the home, keeping it free from the insects. But these, when coming in contact with children, unknowingly, if they're taking it, unknowingly, if they're consuming it, if they are adding it into their mouth, this may lead to poisoning cases. Camphor, which is popularly used in during pujas, the silica gel, which is available in small packet forms in food products for keeping the food uh, safe, where keeping the food free from moisture. These silica gels, which are available in small balls, even the cosmetic products that we are using at our home, all these are constituting the type of poison which leads to poisoning. So we can see that you don't need a specific material to cause poisoning or for poisoning to occur. Even our day-to-day household products that we are having, these are also sufficient to act as poison. So moving ahead with this common causes of poisoning, now that we know that what can be causing the poison or what will be categorized into poison, we can see that how poisoning is occurring based on the root. If we go for ingested poisoning, it may be because of certain substances like medications or household chemicals, foodborne toxins. And how do we identify whether the poisoning has occurred or not? The first step that generally occurs is identify whether actually poisoning is occurring or poisoning is not occurring. If we see sudden symptoms of nausea, vomiting, diarrhea, abdominal pain, which are considered as the first signs and symptoms of poisoning, and if they are not associated with any disease or these are occurring followed by ingestion of certain materials which you might know or might not be knowing, this can be a cause of poisoning. For inhaled poisoning, we can have substances like carbon monoxide, the smokes, chemical fumes, etc. It would present itself as person is having difficulty in breathing. They may be experiencing sudden chest pains, dizziness, confusion, stupefying activities, etc. This may be signs of inhaled poisoning, which should be checked first. Absorbed poisoning, that is skin contact poisoning, which may be because of industrial chemicals or pesticides. You would be examining the body. If we see certain redness, blisters, burning sensations, which you do not know suddenly, many a times we feel that some bruises have occurred to our body, some eruptions are seen, some redness is seen, but we don't know why it has been caused. Now, this can be because you have rubbed yourself against a contact poison, which has come, which is still on your skin, and it is causing these sensations. So, if it is so, you can check it for that. Or it may be injected poisoning, which may be because of drug overdose, insect stings, snake bites, where the venom has directly entered into your systemic circulation. Now, this presents itself as pain at the site. There is some kind of swelling, there is dizziness, nausea. Many a times, injected poisoning is difficult to determine at the first go. This is because, as you can see the symptoms, you would be having the pain at the site, and the other symptom would be directly dizziness or nausea. To check the overall body where there is some marking for injected sites, like some kind of rupturing, some kind of cut is very becoming very difficult. And so generally injected poisoning is first time, in the first go it is missed out. But thorough examination will help us in understanding whether it is an injected poison or not. If we go for classification of poisoning according to the motive or nature of use, it may be homicidal, that is, people generally use arsenics, which are slow poisons, aconite, which is one of considered as the queen of poisons, digitalis, Abrus precatorius, this is a plant which is commonly known as chanoti in Gujarati, and Strychnus nux vomica, that is kulcha. All these are the substances which a person with a homicidal motive or a person trying to deliberately kill someone would be first time preferring or using because of the easy access and ability to make the other person inject it very easily. If you see the second category, the motive, it may be suicidal when the person is because of some or the other psychiatric issues or because of some other issues like not able to handle certain things, may opt in for these suicidal tendencies. If the person is having, they would be preferring our drugs as an overdose method for killing themselves. This includes the opiums, barbiturates, organophosphorus compounds, carbolic acid, and even copper sulfate. Accidental poisoning, which is unintentional, which doesn't have any motive. This may be because of accidentally or unknowingly injecting ourselves or ingesting ourselves with aspirin, organophosphorus compounds, copper sulfates, snake bites, ergot, carbon dioxide, carbon monoxide, gases, as well as hydrogen sulfide. It may be abortifacient. Now, abortifacients are also a category of medicines or a category of motive which may be leading to poisoning, like ergot, quinine, and calotropis. These are very prominently used for killing the unborn. Uh, and there may be materials like dhatura, cannabis, chloral hydrate, which are using as stupefying agents. Now, these doesn't have the intention of killing someone, but they are having the intention of causing confusion in the mind of the person so that they may not act the way they are supposed to act. And this may lead to further type of issues associated, that is for some other criminal motives. So, knowing that what are the different ways of poison maybe spreading, what are the different ways of poison can be given, and what are the different ways, what are the different substances which can be used as poisoning. What is of more importance to us is how do we manage the poisoning. So managing of poisoning can be divided into two main categories. That is, first is diagnose the poison, and the second is treat the poison. Now, this might be seeming a step-by-step procedure. Uh, the second, the treatment options that we are generally seeing, we generally think that diagnosis should be done first and then we should go for treatment. This is the general case scenario with all the conditions that we are having. But one thing in case of poisoning that is of more importance is diagnosis and treatment generally occurs hand in hand in case of poisoning. Toxin diagnosis, we can divide it into three steps, and this is the role where we as a pharmacist would be of more importance than in treating of the poisoning. So, what we should be aware of, or how we can help a patient, or how we can help a person who may have come in contact with poisoning, is this is where we can help them. The first step in toxin diagnosis is history taking. Now, this becomes very much essential. What are the things that we need to know before we conclude that it is poisoning is what was ingested, absorbed, inhaled, or injected? What was the material? Sometimes the person or the patient who is suffering may not be able to answer this, but many a times we might get our answer from here only, which solves all the other steps and lead us directly to the treatment strategy to be followed. Second is how much was the poison quantity, how much was ingested, how much was absorbed, how much was inhaled, or how much was injected. If the patient is in comatose condition or in unresponsive condition, which is 80% of the cases we see that it is occurring, then we do not go in for uh, we do not wait for the person to become responsive or come into consciousness. Rather, we can contact the near ones, the families, the friends who are at that time with them to give us this information. When did it occur? That is of more importance because in case of poison treatment or poison management, the time frame becomes very much essential. Then we have to also go for history taking of any pre-existing medical condition, whether the patient is taking some other medicines, whether he's suffering from some conditions or not, and what is the age, weight, and medical history of the patient. This becomes very much essential. The second step in diagnosis is examination. Now, this is more of importance, or history taking is of more importance when we are talking about a patient who is responsive or if he is surrounded by people. But if he is not responsive or if he is not accompanied by anyone, we can directly jump to the second step, that is examination, where we might go for undressing the patient completely for thorough examination for signs and symptoms. Check the clothing and for objects or substances, particularly if the homicidal type of condition is there or suicidal condition is there. There may be some material which may be present in their pockets, or they may be present in their wrists or their arms. They may be holding it, or if they are in the poison is in the form of powder. When ingested, it might have fallen onto some materials. We can check that. Assess the general appearance of the patient, what kind of state the patient is in, whether he is unresponsive, if he is responsive, to what level the responses are there, whether he is in this world only or he has zoned out. These are the general appearances that we need to examine. Examine the skin for bruising, cyanosis, flushing. One of the best example of this is if you see that arsenic poisoning. As I said, arsenic is a slow poison, but it can be immediately assessed if you're checking the nails of the patient. If there is blue color deposition that has been bluish black deposition that has been seen in the nail beds, this might be a sign of arsenic poisoning because arsenic gets deposited in your keratin. This is also seen in hair follicles also. But examining hair follicles for the same color might be difficult. Nails would give out whether arsenic poisoning is there or not. Then you assess for the A, B, C, D, E, which is very much important in case of poisoning. That is, check for the airway, breathing, circulation, any kind of disability or exposure. Check whether the person is breathing properly or not, whether the airway is clear or not, circulation, whether there is rapid heartbeats or lower heartbeats, whether the heartbeats are getting lower and still lower, whether there is some disability that is seen in the person, or whether the person is still exposed to the poison or not. And the third step of diagnosis would be including the diagnostic test, where blood tests are done, tests are done, EEG is done, EKG is done. These are the tests which a medical professional would be performing to determine accurately what type of poison has been injected. If we see certain of the cases that would be helpful to us in understanding the poisons, if we see the case one, a patient presents himself with conditions such as coma, hypotension, respiratory depression, and decreased muscle tone. If we see all these four symptoms, we can conclude that the person might be having some barbiturate or benzodiazepine overdose along with alcohol intoxication. In cases like a patient is presenting themselves with coma, slow respiration, and if we check the eyeball and if we find that there's a pinpoint pupil, we can definitely say that the person is having an opioid poisoning, and we should stop or start directly with treating the overconsumption of opioids. Case three, now this case is very much essential because this is very rarely being found out. If the patient is presenting with tinnitus, ringing in the eye, deafness, along with hyperventilation, the person is not able to listen properly, he might be suffering from ringing sensation in the eyes and hyperventilating without any reason, the chances are there that he might be suffering from a very common cause of salicylate or aspirin overdose. So this type of cases would be helping us if we go for all the other different causes of poison or the materials that are being consumed as poison. We would be seeing that each category is representing itself with certain specific symptoms or certain specific signs and presentations, which might help us in narrowing down that what kind of poison the person might have consumed. The most common drug that is being used, that is paracetamol. We know that paracetamol is generally regarded as the most safest drug. People might be of the knowledge that PCM doesn't cause any kind of poisoning. PCM is safe drug. You can take PCM anytime you want. And we have always been seeing this fact that PCM is popped like chocolates by many of the patients. They are not aware with when to take, when to stop. If a person is having a headache, chalo, let's take PCM. The headache is not coming down within 1 hour or 2 hours. Let's take some more PCM. Again, if you're representing with something else, okay, let's take a Dolo. Dolo has become very, very popular nowadays as a pill. People are thinking that Dolo is like a more like a nutraceutical, more like a supplement rather than considering it as a medication. Though PCM is considered as a safe drug, PCM poisoning is there. The dose, when we are exceeding the limits that are needed to be taken, it leads to PCM poisoning. Can anyone let me know what is the safe consumption dose of paracetamol? Anybody? You can just put it in the chat box if you know the safest dose. 650 milligram is one of the answers that I got, but 650 is one first dose that is being taken. Okay, so I'm having multiple answers available over here with me, the dose of paracetamol. So when we are talking about the adult dose, it is somewhere around 500 milligram to 1000 milligram, which is generally taken 4 to 6 times or 4 hours to 6 hours gap should be there. And we are having this, but the maximum dose that is accepted or considered as safe in 24 hours is 4000 milligram, which is translating to somewhere around 4 grams. And in case of child, it is 15 milligram per kg, and it is to be divided into 4 to 6 hours. After every 4 or 6 hours, it can be taken, but it should not be exceeding certain limits. If a person is taking paracetamol randomly without having any control, and if somehow is exceeding 7 grams of paracetamol a day, that is 7000 milligrams of paracetamol a day, there are chances that there would be poisoning. But when we see about PCM poisoning, we are not able to judge it in the first go that it is PCM poisoning. This is because the PCM poisoning represents itself in 5 different stages, where the stage one, within several hours of consumption, you might be seeing that the patient is having vomiting, but there is no other symptoms available. The patient seems well to do, he's not ill, he's not representing any other symptoms, just symptoms of vomiting. Stage 2 is within 24 to 72 hours, you may see that this random occasional vomiting would be converted into nausea, vomiting, and abdominal pain, right? Stage 3, that represents itself after 3 to 4 days, the worsening of vomiting is there, liver function is reduced, jaundice-like symptoms would start appearing. Now, at this stage, after even 2 3 days, the vomiting is not stopping properly. Generally, we don't even wait for 2 3 days. Even in one day, if we have not seen the reduction in the vomiting, we might visit our uh, physical practitioner. We might go for solutions, and they may just symptomatically treat us with the condition of vomiting. They would give us anti-emesis medications. They would advise us to have fluid intake. 3 to 4 days, the condition would worsen, convert into jaundice-like situation. Then the testing for jaundice and everything would be done, but the underlying cause, that is PCM poisoning, may not be addressed. And if we continue this after 5 days, there are chances that there is failure of liver and other organs. So you can see that a safe, considered safest drug, if it turns out to be a drug which causes poisoning, within 5 days, there are chances that there would be multiple organ failures, and this poisoning represents itself in such a way that we are not able to initially diagnose it, that is diagnose it within 3 to 4 days. So this shows that how severely a small molecule which is considered as safer molecule may turn out to be life threatening. So when we are going for these kind of diagnosis, this helps us in preparing the toxiderm, that is the complete compilation of the finding of the symptoms. And this toxiderm would be very much helpful for the practitioner, for the emergency medicine practitioner to go for the second stage, that is treatment of poisoning. Treatment of poisoning is the holistic management of toxins, generally starts with resuscitation and stabilization. It is divided into 5 stages. Stage 1, that is ABC stabilization, whereas airway, breathing, and circulation is stabilized. Stage 2 is blood sugar is checked and opioid reversal if there is any signs of opioid poisoning. As we said, simply checking the eye, find the pinpoint pupil. If it is there, opioid is given, and you have to immediately go for opioid reversal. So that becomes a stage 2. Stage 3 is decontamination, that is remove the poison from the body. Stage 4 is go for its specific antidote. We do not start with antidote first and then removal of the decontaminant, because the poison lying in the body is going to be more harmful. So it is firstly important that we remove it completely and then we go for antidote. And finally, we go for stage 5, that is supportive treatment. So stage 1 and 2, resuscitation, stabilization, blood sugar management, as well as opioid reversal, this starts together, where the first priorities is airway, breathing, and circulation. For that, you should ensure that the airway is clear and the patient is breathing. Assess for the vital signs like heart rate, blood pressure, respiratory rate. Monitor the level of consciousness. Unresponsive patients would be treated with coma cocktail that consists of oxygen for the breathing, naloxone for the opioid reversals, the dextrose 50W, that is commonly known as D50W. This is for maintaining the blood sugar level, as well as 100 milligrams of thiamine, that is vitamin B1. This would help in preventing any nervous damage to the patient because of the poison. For adults, we go for 50 ml of D50W and 1 gram per kg glucose for children. But thiamine is generally not added when the child is suspected of poisoning case. Stage 2 is decontamination and immediate measures, where we can go for emesis, that is inducing vomiting, gastric lavage. Activated charcoal may be used, or if we are not having an ingested poison, or because the poison is in the form of a contact poison, you can go for decontamination for skin and the eyes. MSS, this is generally advised immediate cases, that is within 1 hour of poisoning, we can go for it. But this is contraindicated in certain cases, that if you have found out that the poison is in the form of some corrosive poison or some hydrocarbons or strong acids or strong alkali, do not go for MSS. It will cause more damage to the patient. This is rarely used nowadays because of risk of aspiration, that is during the MSS, and if the patient is in semi-responsive or unresponsive state, the vomits would be returning back and it might go into your pulmonary circulation and get deposited in the lungs, which will further lead to difficulty in breathing. Normal practice of using salt solution for MSS should not be practiced in case of poisoning. We all know that if we go for a concentrated or saturated solution of salt, common salt, NaCl, that induces MSS, that induces vomiting. But when you are talking about poisoning, this should never be done. As such, also, this should not be done because it may lead to fetal hypernatria. And this is generally achieved using syrup of ipecac. Syrup of ipecac is used for inducing MSS. The dose is between 15 ml for 1 to 12-year-old patients and 30 ml for adults. It may be repeated once or twice. Within 20 minutes, 90% vomiting occurs, and with the second dose, 97% of vomiting occurs, and which leads to removal of the poison. But this should be practiced only when you are sure about what poison has been consumed, and if it is immediate, that is within 1 hour of consumption of the poison. Second is gastric lavage, where the emptying of the stomach is done within 3 hours or so. If you find that this is the case, you can go for gastric lavage. But if it is more than 3 hours or if it is a delayed condition, one should not go for gastric lavage. This is not recommended for caustic substances or sharp objects being ingested. Gastric lavage should not be encouraged for solid poisons, as when you are feeding the stomach with the fluid, there are chances that because of the pressure, instead of the solid coming out during gastric lavage, it would be pushed further into the intestine, where what your aim is, that is remove or decontaminate, but it would be more absorbed when it is entering into the intestine. And it may also cause aspirational pneumonia. So gastric lavage is also the first choice that people might be thinking whenever you're talking with anyone, or whenever you are discussing it with certain medical students also. You might see that for poisoning, the first response would be gastric lavage, but gastric lavage is to be practiced with care, and time is very much important in such cases also. The best practice to be done is activated charcoal. The use of activated charcoal, this is to be administered within 1 to 2 hours of ingestion when the patient is alert. This works by absorbing the toxins and preventing the absorption of the toxin. It is more appropriate agent to decontaminate your GI tract, and it would simply do what it would do is it will absorb the toxins and not allow the toxin into entering into your systemic circulation. This safely proven, safety is proven in both adults and children. It is available in the powder form, it is available in the tablet form, both can be used. The dose is 1 gram per kg, and it is useful when the drug known to absorb it or after unknown ingestion by the patient with protected airway. But it is not useful if you have identified the poisons to be cyanide, ethanol, ethylene glycol, organophosphorus compounds, and strong acids and strong alkali. So if you have pinpointed your poison to be of any of this category, activated charcoal might not be useful in managing poison. So for that cases, we can go for whole bowel irrigation, where the fluid is given through NG tubes, that is nasogastric tubes, to the flushing of the fluid is done till the rectal effluents, that is whatever is coming out of the rectum, is very clear. The bowel cleaning solution, that is CleanPrep, is to be used, which consists of polyethylene glycols plus electrolyte solution. Normal saline is not to be used in such cases, and useful when sustained release poison is there, when the child or patient has consumed popped up button batteries, or it is also used for cocaine pockets, which in case of drug dealers, when the drug dealers are transporting cocaine um, from one country to another country using their body as the parcels, At that time, certain times what happens is to pop out or remove the cocaine pockets, or if the cocaine pockets have ruptured inside the body, then to remove those things, this whole bowel irrigation is being done. Poison management algorithm generally says that if it is an ingested poisoning, you confirm the substance, considered activated charcoal or gastric lavage, and provide it with an antidote if necessary or if available. Inhaled poison, you move the patient to fresh air, that is the first thing to be done. Provide them with oxygen and administer the antidote along with supportive care. And in case of skin or body contamination, we go for washing the affected area with water or saline till the washing liquid is clear with no poison contamination or traces of poisoning, followed by administering the specific antidote or treatment. Sometimes what happens is in case of ingested poison, the poison has already entered into your systemic circulation. It is flowing with your blood, it is not coming out. And in those cases, we may have to go for enhanced elimination, that is cleaning of the body. Enhanced elimination may also become a part of your supportive measures where we can go for alkalinization, forced diuresis, or we can go for hemodialysis or hemoperfusion. Alkalinization is leading to making the urine as well as the body fluid pH at the alkaline side. This is very much useful in case of herbicides like 2,4-D, phenobarbital, chlorpropamide, salicylates, and methanol, where IV dose of bicarbonate is initially given, followed by intermittent bolus drops. So this leads to changing the pH of the system to somewhere around 7.5 to 8, and alkalinization helps in earlier removal of the poison from the body, but it may lead to profound hypokalemia, so this must be monitored regularly. Hemodialysis and hemoperfusion, where dialysis is being used for removing the specific toxins like salicylates, methanol, ethylene glycol, lithium, theophylline, and certain kind of mushrooms. The benefit is removal of toxins which have already been absorbed by gut. These can be removed very much easily. And even if the poison has been started to be metabolized, and the metabolite can also be removed by hemodialysis, but it is less effective when the toxin has a large volume of distribution, or if it is of the larger molecular weight, or if it is bound to our protein. So in those cases, we may go for hemoperfusion, where decontamination is done, but an additional filter is fitted into the dialysis unit, which is having activated charcoal. So the blood is going to come in contact with this activated charcoal, and all the toxins are going to get absorbed over there. Plus, additionally, we are also having the advantages of hemodialysis. Okay. And the fourth stage, that is antidotes and specific treatments. I was not able to mention all the antidotes, but the common cause poisons and the specific antidotes I have tried to mention over here. Like for opioid overdose, you can go for naloxone, or which is available as Narcan in the brand name. Paracetamol, that is N-acetylcysteine, should be used. In organophosphate poisoning, atropine and pralidoxime is used. Iron overdose, it is gone for deferoxamine. Benzodiazepine, you can go for flumazenil. And methanol or ethylene glycol poisoning. Then, in case of methanol poisoning, ethanol is considered as an antidote because of competitive metabolism that is being there. It will not be allowing for the absorption of methanol, that is fomepizole or ethanol is being used for the antidote. Selection of antidote and specific treatment is very much in the hands of the practitioner under whom the patient is there, and your ability to diagnose the correct poison that the patient has consumed. Stage 5 is the supportive care, where we go for electrolyte level monitoring. Renal function should be monitored regularly by close charting or of intake and output and serum creatinine levels. Liver functioning to be monitored. Multiple dose of activated charcoal, if still required, may be used and may be considered. See, in case of poisoning, what has been seen is just removing the cause of poison and giving the antidote is not sufficient, because under what conditions the poison was taken is very much mattering the life of the patient. If the patient is having some suicidal tendency and he is taking the poison, then supportive care should include stabilizing the patient, understanding the patient, counseling the patient, then and then only the life of the patient would be coming back to the normal tracks. If it was unintentional or if it was because of the homicidal uh, intentions, the patient is already in a shock. They are in, even though not consumed, they may be in a stupefied condition. The shock, the trauma that they would be experiencing, it would be very difficult to come out of that and lead a normal life. So, supportive care is not just giving the medicines to correct the body functioning or maintaining the levels, but it should also be going for therapies which are helping the patients to come back to normal conditions to lead a life, thinking that this incident never happened in the life of a patient. So, better is if we go for poison prevention. Some things that we can do or we can advise our patients, or in some cases for our us pharmacists, our consumers, that how to be as much far away as possible from the poison. So, what can be done is we can always keep the medicines and household cleaning products out of reach of children. This thing is very much essential. Generally, in terms of household cleaning products, what we have observed is these are occupying that part of our wardrobe or of our cupboards which is easily accessible to a child. Household cleaning products are always kept at any houses just below the sinks, or it is kept at the lower shelves rather than keeping it at the higher shelf, and a child is easily able to pull open the door and take these household products, because most of the household products are very fragrant, they are very attractive in the color, and the child is tempted. Plus, when the child sees the bottle and he is told not to go near it, the child would be going first near it to pick it up. So we make sure that we always keep these products out of reach of the children. Turn on the light when you are giving or taking the medicines at night time, so that you know that you have taken the correct amount of the medicine, you have taken the right amount of medicine. The patient, if you are giving the medicine, make sure that he has already consumed it. The tablets are not falling on the grounds, they are not lying there unattended so that nobody else can take it. Keep the medicines in their original bottles or containers. Now, we are of this habit that if we have a half bottle, we might go for mixing of the bottle, or if we find the bottle attractive, we might even take out the content, keep it in some other safe place, and we might use the bottle for keeping some other, particularly in the kitchen, the spices and certain stuffs. Whenever we are using the pill boxes, also we are taking out the medicines. If they are in the strip packaging, there's no issue, but if they are in the bottle form, we're taking it out, keeping it in the pill boxes, and the bottle that is remaining empty, now we are using it to store some other products. Unknowingly, if we don't know what the other product is, that might also lead to some cases of poisoning. Monitor the use of medicines that are prescribed for children and teenagers, such as medicines for attention deficit hyperactivity syndrome or the ADHD condition. Children with disabilities, mental disabilities, or some children with who are hyperactive or who are having ADHD, you should monitor them and use their medicines or keep their medicines differently. Only take the prescription medicines that are prescribed by a healthcare professional. Now, this is very much important, and this is where we also need to be very careful that we are not prescribing or we are not giving the medicines without taking the prescription into consideration. As we saw earlier, also, a simple paracetamol may also harm a person, so advise them properly that how is to be taken. Never share or sell your prescription drugs, and follow the directions that are written on the label when you give or take the medicines. This is how we can help or we can contribute in preventing the poison. Concluding the talk, I would be saying that the key points is that early recognition and prompt management are crucial for a positive outcome. Poisoning can be life-threatening, but with proper intervention, many cases can be managed successfully. And collaboration with poison control centers and healthcare professionals is vital. The final reminder says that always call for professional help in suspected poisoning case. Now, what might we see is who is a professional help? One example that I have here is NPIC, that is the National Poison Information Center, which is available in all the cities, just that we sometimes do not identify, or we sometimes do not know whether our city is having this NPIC or not. There is no need for going there physically to have information. 24/7 services are available, teleservices are available where you can simply call the NPIC. This flowchart is representing the functioning of NPIC that is present at AIMS New Delhi, which is managed by Department of Pharmacology over there. They are receiving the calls, poison calls 24/7. They're not missing any call because they know what is the importance of poison management and quick and prompt responses. They are a team of health professionals and general public. They are having access to almost all the poisoning related databases and books. So once you present with the call, once you call and tell them what the condition is, what the patient have uh, consumed, or what are the symptoms, if you present them with the toxidome, they will refer the database immediately and a quick prompt response would be provided by them. The outcome that they are having, they themselves are documenting it, they are data analyzing it, so that certain cases, certain new specific cases, if they are also coming up, they can have it as a history for matching. And this also helps in better management strategies for awareness and preparedness. They would be guiding you of what to be done, what type of solution is to be provided till the time you reach the hospital, what you can do so that the poison is not going into the poison is not spreading more or harming the body. It is always said that do it right. That is the right over here stands for resuscitation. In certain cases, you might have to go for immobilization, go to the hospital and talk to the doctor. That is what is very much essential in case of poisoning. And with that, I conclude my talk. If you need to know anything.
Madam, there is two questions from the participant.
Yes.
The one is alcohol intoxication poisoning. What does it mean?
Uh, when you are going for alcohol intoxication is when you are going for overdose of alcohol, and particularly alcohol intoxication, not just consuming excess amount of alcohol, but if the patient is already on the medication, if is already taking some other medication, this medication may be interacting with the alcohol overdose that has been taken and lead to some other complications. That is what is alcohol poisoning can be because of only and only alcohol exceeding the limit that is being consumed, and it may also be because of the additional medicines that the patient is taking or the other materials that he or she may be consuming with the alcohol. And generally, it represents itself as mental disability, functioning not properly, not able to the confusion, deliriums that are there, the judgment of the patient might not be there, the person will behave at random, and so on.
Okay, madam. And another question is expired drugs also have a poisonous or the toxic effect.
Yes, they do. Expired drugs do have the uh, poisoning like effect. They You don't know whether the expired drug have been when we are talking about the expired drug, it doesn't generally mean that the drug is the drug is having lesser concentration or it is not able to elicit a therapeutic response. Many a times it may be converted into some other products which might be of some other physiological response that we might not be seeing.
Okay, madam. And
So
one last question is how much time taken, how much time body takes to decompose alcohol?
now, this question is slightly difficult to answer because if we see the population, we have two different categories of people, that is slow metabolizers and fast metabolizers, or what we call it as rapid metabolizers. So, one dose of alcohol might be okay for one category of person, or it might not be okay for another category of person. If the person is a rapid metabolizer, he or she may be able to consume more amount of alcohol, and their body will allow them to take up that much alcohol. But if he is a slow metabolizer, the alcohol would be present in their body for a longer period of time, and they will not be able to tolerate the alcohol levels as much as another patient would be taking. But to my belief, no amount of alcohol is good for your health, whether it is small or whether it is large.
Okay, madam. Uh, Thank you, madam, for sharing us such a valuable and informative sessions on the poisoning management. Now, the next instruction for the participant. Now we are having a lunch break from the 12:45. You can able to join the session third link, and there is a confusion between the session 2 and session 4. So due to this some technical error, the session 2 and session 4 they are the interly changed. Session 4 lecture is already covered in a session 2, and in session 4 there is a lecture for the session 2. So all of you have to join the session 4 for the session 2 lectures. And now we are having a lunch break. We again meet at 12:45 p.m. Okay, madam, you can leave. Hello.
Thank you, Krunal. Thank you, everyone.